This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Tonight we're going to talk about how to prevent breast cancer. We're going to give you a quick guide to everything that you need to do to totally avoid breast cancer and to be able to live a healthy lifestyle. We've invited Dr. Daniel Beilin. He's a doctor of Oriental medicine and a licensed acupuncturist. Welcome, Dr. Beilin.
Thank you. Thanks for inviting me.
Dr. Beilin is in practice in Aptos, California, and also here in the Boston area. He's well known for his integrative approach to oncology, also helping patients with diabetes, brain dysfunction, and all issues relating to men's and women's health. He's also testified before Congress on the early detection of women's cancers. He's taught for entrepreneurs such as Anthony Robbins, and he's the personal doctor for Hollywood celebrities such as Stevie Wonder and Jane Seymour. Dr. Beilin holds a patent for a new technology in thermography that will detect diseases 1 to 10 years before symptoms develop. So let's jump into our topic tonight on how to prevent breast cancer. Dr. Beilin, you're going to give us some tools to understand on what we could do for lifestyle to understand what is behind the causes of breast cancer and how to avoid them. So how do you know these tools are going to be effective? Is there research and studies behind them?
Well, there's a lot of research, and you know, when we go to our doctors here and we talk about alternative techniques, they usually say, where's the studies? Where's the double-blind trials? Where's the things that mean something to us? And the truth is, these do exist and they're being done worldwide. There's some kind of a time warp that happens between American medicine and the rest of the world medicine, even though Europe and other countries all over the world have just as good medical systems and trainings as we do here. I'm sure you wouldn't ever go to a doctor in Germany and think that he doesn't have the same training as someone from Harvard. They have exactly the same training. A lot of them come here for special things and we go there. And what the truth is that they do have many, many studies that don't get over here. They don't get published here. And there's like a blackout. When I was testifying before Congress, Dan Burton, head of the Government Reform Committee, actually asked one of the top guys from NIH, who's a gynecological oncologist, why is it that these things are happening in Europe and we don't seem to know about them? And his answer was, well, many of our doctors do go to seminars in Europe. Now that's not answering the question.
Right.
The truth is, we don't go to them very often and we don't look and translate all of their papers to ours. And we have an attitude that we're the center of everything. And that maybe was true in the 50s and 60s. It's no longer true at all. And they actually have surpassed us. Yeah. In many ways.
And I think in many ways that we have discredited or discounted even the studies that have made it over here.
Yeah, also when we do show them, then they say, well, we'll have to look into this, but nothing changes. And so even if you were to produce these studies for them, unless they're done right here under their, and even then they might even criticize, well, there's one factor you didn't do right. And in reality, we have to pay attention to what actually happens. If we question 100 doctors that are each seeing 100 patients every week, and we ask them, okay, what happened to you? What happened to your patients? Let's keep some records and look over our records. They will say, and we have meetings all over the world every 3 months, 6 months, they will say, oh, yes, this does work, and I have seen this percentage of cancers be put in total remission by using these techniques. And that does mean something. And our medicine system here has no value for empirical evidence of what actually happens in these patients that get better. They don't regard reality and the realities of what happens in these multidisciplinary clinics with any credence. And it's a very strange thing. It's something that Europe actually has publications that are just made from these empirical experiences of doctors.
So from these empirical experiences and this clinical data that you've been exposed to in Europe and even in your own practice and with doctors here in the United States that you're associated with, what would you say are the main factors behind breast cancer?
Okay, so we take someone, and there's different kinds of breast cancer. But let's take one of the most common ones, which is DCIS, stands for differential carcinoma in situ. And it usually starts with little microcalcifications or calcium deposits that are sparsely thrown around, and they're spread through the breast tissue or part of the breast tissue. And they act as focal points for then tumors to grow. And this is the most reversible kind that we've seen through changes in your body chemistry and through the things that I'm going to discuss as the most easy to put into remission with no surgery and no chemotherapy and no radiation. And many patients come to me and say, there's no way that I'm ever going to get those therapies. And I say, well, I beg to differ sometimes, because chemo has worked with this, and in others it's best to do surgery first. So I'm going to just tell you in a really quick way, give you your toolbox for what you need to know, so that you hopefully are going to avoid any kind of onslaught. And with many people, it's impossible to avoid, because you can change your diet, you can do a lot of these things, and there's still factors that we don't know at this time. There's a lot we don't know, and that's what we always have to keep in mind, because there are mechanisms that maybe we'll discover in 10 years from now or 30 years from now, and right now, what can we say about those? I can't give you some of the tools of mechanisms that we still don't know about, but we can give you everything we know right now. And it's a lot more than what your doctor's going to tell you.
Right.
And you can find it in different books, but it's not going to be in a condensed version. So
the main factors.
The main factors, there's really 5 main factors. So the first tool that I want to talk about is birth and what happens at birth. And this is also linked to what happens at conception. So this involves the parents and what's going on between the parents. So this is something that you all should look into and find out what are the details of your own birth. Because as we generate more and more effective methods for unwrapping what can later lead to cancers, we're going to find that many things that went wrong during the birth process are affecting us and develop and create patterns that we haven't let go of, and we can't figure out why we're falling into some of these traps. So one of them around birth is C-section. C-section are being done too often. There was a period where they absolutely did too often. Now they've gone into more vaginal births, but a C-section doesn't allow the normal compression of the skull, and the feeling of attachment towards the parent is depreciated, so that this forms an emotional need of bond that sets up for patterns later on that disturb emotionally the kids, and it reflects into their teen life, adolescent life, and actually affects hormones for their whole lives. So this is, the C-section is one. Another one is breastfeeding. Now they know that breastfeeding does help the immune system, and this also helps with the bonding, but the breast, especially in the first 3 months, gives colostrum and other necessary proteins to the intestinal tract of the infant that actually helps them to develop a very cohesive and powerful immune system. So this is another necessity, and breastfeeding should be done at least 6 months, if not a year or 2 years. A third one is vaccines. Vaccines is a big controversy, but I don't understand, and there's really a problem with some vaccines, and you have to really speak with both sides and make your own decision on this. But there are some vaccines like hepatitis that are not things that are going to really be necessary for that child because they're not exposed to other people that necessarily have hepatitis type B and the things they have the vaccines for, and are actually giving them problems that they didn't have, along with what's put in as preservatives to the vaccines. So there's more things around the birth and of the emotional bridging between the parents that you should be looking at. And of course, what's going into the birth is genetics. And genetics is no longer regarded as being the only key, but there's a new field called epigenetics, which involves material that surrounds the genes and influences the genes to be triggered. And this material that is coming and talked about through epigenetics is transferred usually from the grandparents and their experiences of trauma during their lives, and its influences, skips a generation and influences the grandchildren in their health. So you should all be doing research into what happened with your grandparents, whether they went through famine, war, things that are very, very stressful to the body, because those will be factors that will carry on and trigger certain things in your genes today that can represent the endangerment of breast cancer, like the BRCA gene family and these things that they test for at our universities. So this is something that you need to just find out about and learn. And then how do you treat this kind of a problem? That is by some of the new work that's being done by pioneers, like there's a man named Ray Castellino, and he has you relive a healthy birth experience, and that's with reforming your attachments and your support during the birth process, and kind of like teaching your organism what it is to have a healthy birth, and that can get integrated and then form a balance in the system. So that's number one, the birth and whether there's trauma and genetics. If you want to clear some of these things, don't hesitate to go to homeopathy, because homeopathy, even though some people think that there is nothing to homeopathy, this is a thing that will be found in the research, that when you use micro doses of certain things, like if we want to see, does a hormone work, we need very little amount. We need micro amounts of a molecule to influence, like pituitary hormone is a very micro amount, or endorphins and these kind of chemicals. These are like homeopathy, and homeopathy incorporates patterns from the original substances that give information to your body to let go of these patterns. So it's really patterns and habits, both biological and psychological, that add up and cause stress to the body, and then it goes over the edge to produce a tumor or a health condition. So that's number one. The next piece for the toolkit, number two, is how did a cancer become able to express itself? What happened? Do you think a weed just grows out in soil because it's a weed and it's only a weed and that's the only reason, because there was a seed of a weed somewhere? No. You have a terrain, and your terrain is your body chemistry. And the body chemistry is all of the tissues and the surrounding fluids to all of the tissues. The surrounding fluids to all of the tissues are actually more influential than the organs themselves in your health. This was discovered by a famous German during the 50s and 60s, Pischinger, great name, and he discovered the matrix of the body, or how our interstitial and connective tissue, all the space in between our organs and in between our cells, that furnishes a good communication or a bad communication between organ systems and cells. And what we want to do, and here's the answer to this, is we want to find a way to assess how bad our tissue environment was, so that the tumor is not allowed to be in a place where it can grow. So if we have good soil, then we won't have a tumor grow. There's a reason why the tumor was allowed to grow, and that reason is because something was going wrong with the underlying chemistry. So the way to do this is there's several ways to understand this. Of course, we send people to normal blood tests, and we can get an idea of what's happening sometimes, but most tests are, they all come out normal. The doctor doesn't know why, but you have normal tests and then you have cancer at the same time, and they just say, well, you just have a tumor. That's not true. You have to look at the actual characteristics of oxygen in the body, you have to look at mineralization of the body, and you have to look at the pH of the body, which the tissues can vary in pH. The blood is a fixed pH, but the tissues can be more acid or less acid because they are storing the electrolytes and the minerals differently than the blood does. So this has to do with tissues and the space between the tissues. And the most important thing is oxygen. And how can we oxygenate better? We can do it by exercise. So that's one answer. The other answer is we can take things that nurture our oxygen dispersion mechanisms. So we can take coenzyme Q10. We can help our blood to carry oxygen better, and we can help it with either Chinese herbs or sometimes B vitamins, but you have to be careful with B because they can actually make a tumor be fed in the wrong way. And vitamin C, by the way, helps to establish better cell communication because it's called a hyaluronidase inhibitor. It actually helps any blockage to communication between cells not happen, and it keeps the safety of the cells communicating with each other. So vitamin C, if it's in a buffered ascorbate form, is very, very good. So here's the second reason why a tumor can grow, and everybody needs to at least address this in some way. The best is exercise. The next is diet, and diet can drive your body into an acid state or into a healthy alkaline state. And the key to that is less meat and more vegetables. So that's a very quick number two, body chemistry and tissue terrain. So we don't want to allow a place for these guys to live. Number three is a toxin. So how many cancers are being learned that there is a contribution or a trigger of, so a gene can exist in the body, be a cancer gene, but you can go through 100 years and never have the trigger happen to that gene and die of a heart attack, say. A toxin can trigger the gene to express itself, and then you get the cancer. And the toxin can be an exposure that you knew about. Say you were an oil painter, and so you were exposed to a lot of the chemicals in the coloring, like cadmium and lead. And then the other famous toxin we have now, there's two big toxins that we have right now, and everybody has it, and it's getting worse in the environment. One is mercury, which when they take it out of your teeth, it's regarded as hazardous waste, and it has to be disposed of in a special way. But at the same time, they can say it's okay for it to exist in your mouth for 20 years. It makes no sense. Mercury is a known toxin. Any chemist will tell you that. And we have it all over the place, not only in the teeth, but in some of the food supply and some of the things we use. And there's a way to assess what metals are toxic in your body. We do a challenge test, and then we measure the urine and send it to a laboratory. So mercury blocks the lymph system, and the lymph system controls a lot of the breast health. So mercury is number one to clear out. So you need to go to a an alternative or integrative doctor and ask to have your mercury and heavy metals tested. So this is the most important toxin in our environment. The other is the plastic industry. Plastics are directly related to breast cancer, and they've done double-blind trials on a lot of the plastics that are in our environment. All of our Earth is being flooded by plastics, and they do have new rules, but they were burning plastics in hospitals from the disposables that they would use, and the incinerators would let the plastics go into the air, and people are breathing that. The other toxins, of course, can come from radiation and too many x-rays, or the people that do whole body CT scans are getting about 1,000 times the amount of radiation you get in a year from a dentist office. So that's number 3. How do you remove this? You first try to measure whether you have these things. It's very hard to measure plastic exposure. There's a few tests for the immune system that are very complicated and not necessarily accurate, but the heavy metals are the number 1 thing to have checked out. That's number 3. Number 4 is hidden infection. Hidden infection. So if you had an early childhood with a lot of tonsil infections, this stays somewhat in the body. Just because you had antibiotics or had them removed does not mean that there's not other glands that are holding the strep bacteria or various virus information, and that these still flow. They can be in the body for 30 years, and they can be at a low enough level that you just go about your life, and you might be a little bit more tired than normal or not. So you need to look and see whether there could be hidden infections. The best way to identify this is by regulation thermography, which can actually it's approved by FDA here for identifying hidden infections. And so Jackie Bell is the person that does this in this area, and then we take these results and analyze them, and we can see whether there are hidden infections. Hidden infections come from the sinuses, they come from the tonsils or adenoids, and they come from the teeth. Also the appendix. You can have a hidden infection in an appendix for 20 years, causing all kinds of health problems, never know about it until finally something does happen, or even never know about it because it's not bad enough to become something that causes a fever and needing surgery. So in the teeth, you can have hidden infections in the root of a tooth. This is very common with root canals, where you have the tip of the tooth with a metal wire coming down, and there's a little bit of infection left here, and since it can't be nurtured or taken away by the blood vessels as part of the root, it migrates into the jaw, and then it goes to the throat and its lymph vessels, and then it goes to the breast. So hidden infections you can identify with thermography. You can also, hidden infections cause inflammations and inflammatory diseases like diabetes, like chronic fatigue, and there's ways to measure this through blood tests like C-reactive protein tests that a lot of doctors are doing now. So this is number 4, and the way to remedy this is by taking lymph remedies. They're herbal remedies. One of the best ones is called phytolacca. Another one is called scrofularia. These are lymph remedies. So you can go and go to the health food store and ask for a lymph remedy. And also there's lymph massage that comes from Europe. So that's number 4. And the last one, number 5, is your emotional state. The emotions are disturbed when there's a conflict between 2 points of view that are opposing each other inside of us. So if we live with a long-term conflict, then this causes forces within us, and this can be created by past trauma. And past trauma is anything from overt, like sexual trauma or physical trauma, or it can be traumas that are results of things happening that are disturbing and are events that really go deep within inside of us. And the best treatment for trauma was, until about 5 or 7 years ago, EMDR, which they use for a lot of the vets coming back from wars, which is using a special way to help the brain process through the trauma, because while the trauma was happening, the person has dissociated and wasn't able to integrate that experience because they were in a fight or flight reaction. Now what seems to be a very good therapy is called somatic experiencing. That's becoming very big, and it's by a very fantastic genius now named Peter Levine. So he's written a couple of books on trauma, and so it's a very good experience to go through, and it's very subtle, but it affects the impact of the trauma that can go to change your body chemistry to make it more vulnerable and release fight or flight hormones that can stimulate a cancer and do something like what the chemical exposures do. So there's your toolbox in a nutshell.
So we've talked about the main factors. It sounds like most of those factors, we would need a doctor to help us with those. So tell us what it's like for a typical cancer patient, a breast cancer patient, to come to you. What are some of the things that you would do?
Well, when somebody comes to me, I'm not emphasizing any push towards doing anything but working with their oncologist at the same time. But sometimes their oncologists don't know anything about the terrain aspect or the ultimate cause, and they never address those. So they only address the tumor itself, and that's fine with me.
Right.
Because I want them to address the tumor itself many times if they need surgery, or if they really think that some of the new types of chemotherapies or hormone inhibitors will be effective, then we can go somewhere in the middle, and I try to do that. But some that don't or want added, I send them to an immunology clinic in Europe, in Germany. There's about 3. And they actually are able to make a vaccine that's grown from their own circulating tumor cells. So it's an individualized vaccine.
Dr. Beilin, your insights have been tremendous. I think everybody who's watched the show will be able to take something away and apply it to their lives starting this very day. So thank you for joining us.
Yeah, and I'm glad to be here in the Boston area, and I have been coming here about 6 to 8 weeks intervals, and I'm glad to be around such an intelligent educational center of the world. So it's been a pleasure to be here, and thank you for having me.
You bet. If you'd like to learn more about Dr. Beilin, you can go to his website, fortifyhealth.com. My name is Jackie Bell. Thank you for joining us again on Living Healthy.